infection specialist. She's the director of the oral clinic in Nagpur. She's the chairperson of AMCOG's YTP committee. She's the winner of many prestigious awards, and she's the author of books in aesthetic gynecology and infertility. Welcome, madam.
To one and all. On the onset, I would like to thank the organizers to have me here and especially keeping this AMOX session for we being from AMOX family. So yes, I'll be talking about how to get back the O back in your lives. So it's like aha se aha tak. Okay, so this is me, Dr. Parul Sharma. I'm basically based in Nagpur and I'm a practicing gynecologist and an aesthetic surgeon. So the changes in sexuality in perimenopause, menopause and after childbirth. What are the problems which one faces? It's the dyspareunia, which is almost 80%. There is reduced lubrication, which is around 90%. Many times there is postcoital bleeding. There is decreased arousal, orgasm, desire, and many times there is anorgasmia. And as my previous speaker, Dr. Madan, has already highlighted the changes which happen during pregnancy. So they are continued in postpartum phase also. And when it is the menopause and the perimenopause, because of the hormonal changes, again all these things take into play. So whenever there are two women, especially in the perimenopause or menopausal age group, and they are talking, there's a lot of discussion which keeps happening. Urinary incontinence and things like that. So the vaginal dialogue is very common when it is the women. They talk a lot. We haven't seen men usually discuss a lot about their sex life. It is, I think, in their college lives when they discuss a lot. But post-marriage, it is the women who would like to discuss a lot about, how intimate they are and what happens, how happens, and things like this. So let's get into that vaginal dialogue. So these are few papers which mention the impact of aesthetic gynecology procedures on female patient sexuality, the sexual activities and experiences in women who underwent genital cosmetic surgery, and a satisfaction survey of women after cosmetic genital procedures. So today I'll be talking about all those procedures which are non-surgical and how do they help to get and attain a better orgasm and attain a better sexuality. So to begin with, it's the thermal energy-based devices. There is radio frequency, there are lasers, there is HIFU, which is ultrasound, and there is a combination therapy of all these. So when it comes to radio frequency, it is monopolar, bipolar, quadripolar, multipolar, microneedling, which we can do. For lasers, there is CO2 laser, there is erbium yak laser, there is diode and solid state laser, and then ultrasound is HIFU. So there is a lot, but what would suit you is something which you got to choose. That this is the thing which you want to choose. So we are very lucky with the tools. There is so much to be offered. There is CO2 laser, there is erbium yak laser, there is diode laser. So in your practice, what is the kind of patients and what you would want to choose with your patients is something which you need to decide. But in totality, the common mechanism of action for all these energy-based devices is that it stimulates type 1 collagen remodeling and regeneration in the extracellular matrix. There is contracture of elastin fibers. There is neovascularization, which is very, very important. There is increase in the vaginal lubrication. There is restoration for better vaginal milieu and the flora. And the recent studies also show an increase in the small nerve fiber density in the papillary dermis, which in totality would be leading to a better orgasm and better sexual function. So the vaginal health restoration is the improvement in the tissue quality and the blood flow, leading to improved exudate and lubrication. This thickening of vaginal wall and vulval orifices, the improvement of maturation index, hence glycogen content, in which there is increased lactobacilli activity, more acid mucopolysaccharides and mucosal hydration, and all this has been quoted in a journal in 2016. So we can very well see these are the histopathological slides of any of this vaginal mucosa which is being treated by these energy-based devices, and you can see that the vaginal mucosa in the basal condition, the vaginal mucosa of the same 1 month later after using any of these energy-based devices. So you can see that there is a difference, and this is how these energy-based devices help these women. So what is the procedure like? It is an OPD or a lunchtime procedure. It takes around 8 to 30 minutes. We say 2 to 3 sittings are required, and each one approximately 15 to 30 days of an interval, and touch-up sittings after 8 to 12 months. So this is a small thing that what all you need to do. So you always need to put that danger sign whenever you're using any of these energy-based devices. You have to counsel. So this is the machine which I'm using, which is a diode laser. You need to know the settings very well whenever you're using any of these energy-based devices, because that is mandatory. So there are different fibers which are available. We connect the fiber, and we'll see that the fiber which is used for vaginal rejuvenation has a radial approach. So when you see the fiber, I'll be demonstrating that. You can see this is the glass probe which goes inside of the vagina. So it's very easy to be used. There is no need to, turn, twist, because it is a radial fiber, so it will be, putting on the energy at a 360-degree laser. So that way it is really helpful. You always need to put on those glasses. You have to give it to your patient. The consent really makes a lot of difference. So you should be taking proper consent whenever you are doing any of these aesthetic procedures. So this is what I am mentioning about. It is a 360-degree laser. And when we practice infertility also, so we are using those fibers to put the embryo. So there are markings. So similarly, there are markings on this fiber also, and you have to withdraw inch by inch from those markings, so that at every 0.5 centimeters of the vaginal mucosa, this lasing is done. So the entire vagina inside is covered and rejuvenated. So there is a newer robotic vaginal vulvar rejuvenation also, which is now available in the market. So the advantages are, it is painless, there is no anesthesia which is used, there is no downtime, there are no medications, and practically there are no side effects. Now the next modality is these LED devices which are now available in the market. So what you have to do is that you have to wear this undergarment. It is a disposable thing which is to be used every day, and it emits LED, which somehow generates an energy which causes vaginal rejuvenation. Again, the same principle that there would be vaginal rejuvenation, there would be more lubrication and a better sexual experience for both men and women. So this is now available. It is to be used 20 minutes daily. Now coming on to the injectables. So there are a lot of injectables which can be used. We have heard there is a G spot, there is an O spot. So all those things can be amplified using any of these injectables. The first one being PRP, there can be fillers and stem cells, fat or bone marrow. Any of these materials can be used to augment the O spot or the G spot. So the fillers, to start with, they cause vulval rejuvenation by whenever there is volume loss and there is dehydration. So what these fillers do, that they increase the volume over there. So whenever there would be friction which is generated and there is a bulk of this volume which is generated at the G spot or the O spot, so whenever a penis would be moving around that place, then there would be better augmentation and better stimulation. So that is how this helps. So this is what can be used for G-spot amplification, and yes, for vaginal tightening also. Many a times we are doing this, that we are doing fat grafting for the patients who would want to look a little slimmer and all, and we use the autologous fat only for these women to be injected at their G-spot or the O-spot area, and also for the labial outlook, because the outlook also makes a difference and it would improve the sexual experience for both men and women. So now coming on to the shots on the spot. So we're talking about the shots. So these are the hot shots, where we have a lot of hot shots who are sitting out here, Brahmabhat sir and Rao sir and everybody. But we are talking about these shots which are right on the spot. So it is the O shot, G shot and the P shot. So to our surprise, 70% of the Indian women do not orgasm during sex, which is a huge, huge number. And not just during the phases which I have mentioned, but generally also many a times the partner or the woman is unaware that there is something called as a clitoral stimulation. Many a times they have not experienced the G-spot and the G-spot orgasm which they can attain. So these things are very common, and in Indian women especially, the scenario is such that 70% of the Indian women had never had orgasm during sex. So the G-spot amplification, it was a German gynecologist Ernst Grafenberg who first actually got this procedure. So what is G-spot basically? It is the location below or inferior to the urethra, midway between pubic bone and cervix, and it is responsible for vaginal mediated orgasms. So you can see that this is the spot, it's midway, and this is where the G-spot usually is. But for somebody to get a G-spot amplification and augmentation, that woman needs to have had orgasm through vaginal stimulation, because she is the one who's going to be telling us that this is the place where she gets the maximum gratification or maximum pleasure. She will write that spot, and that is the spot where we'll be injecting the filler or the PRP or exosome or autologous fat. Patients should have had a G-spot induced orgasms prior to G-spot augmentation, because then only she'll be able to appreciate that there has been an augmentation of the sexual pleasure which she had earlier. So bulking the G-spot forward towards the vaginal lumen, greater frictional contact, it is easier, longer, more frequent and intense orgasms are something which the women experiences. So like we have discussed, we can even use non-permanent fillers like hyaluronic acid. We can use PRP, radio frequency can be clubbed, collagen can be used, and permanent materials like silicone or polyacrylamide gels can also be used. So the mechanism of action, it improves the collagen content, collagen stimulation and blood flow yet again. So as we say, Manish sir has presented this at many places, and I have actually taken this. It's actually an amrit to female pleasure. Like how you can say PRP is actually like that, because it has a lot of growth factors and cytokines. There is differentiation of pluripotent stem cells. There is neoangiogenesis, fibroblast growth and glandular proliferation. There is new neuronal growth which improves physiological responsiveness. So this is again the same thing. So what we need to keep in mind is that the patient should not be smoking prior 2 weeks, no alcohol, all these NSAIDs should be stopped, and corticosteroids should also be stopped 2 weeks prior to any of these therapies. Consent, yes, is very important whenever you are doing any of these things. 6 weeks is the effect when you will see the maximum effect in these patients. Contraindications, recent fever, anemia, coagulation disorder, systemic infections and local infection at the site of the procedure. The complications can be pain or itching, infections, swelling, bleeding or bruising. PRP preparation is one thing that you have to centrifuge, you have to remove the red blood cells, and PRP, that is the platelet-rich plasma which you attain, is to be injected at the O-spot or G-spot. So you yield around 5 cc of PRP, peripheral blood around 15 to 30 ml is taken, and 0.2 cc of 10% calcium chloride in 5 cc of PRP. But many a times now these days there are tubes which are available which already have this anticoagulant. So all you need to do is that you have to withdraw the blood and you have to centrifuge it, and already the PRP is ready for you to use. So you don't have to instill this. You have to inject that in less than 7 minutes, which is very important. So coming on to the O shot, it was given by Charles Runnels. The same things have to be kept in mind. These are the materials which you require. Again the same, because the PRP which you are preparing is the same, more or less. So what you need to do is that this is the G-spot which we can see there, that curved artery is pointing there. So we inject there, and this is the clitoris. So this is for the O shot which we are talking about. So this is where we inject this. Obviously, before any of these procedures, you have to anesthetize, because it is very painful. So please apply a liberal amount of Prilox, at least for 30 to 45 minutes, so that the procedure for the patient is absolutely painless. That's what I'm telling. It's a vaginal injection and a clitoral injection. Anterior wall into the space between vagina and urethra, most distal from the bladder, 2 to 3 cc is injected, and in the clitoris, 1 cc is injected. I'll just take one more minute. In the clitoris, 10 o'clock and 2 o'clock, and at the base, so that there is a visible clitoral swelling. So the same precautions are to be kept in mind. The PRP is the same, and the P short. Like what we are talking about, O short, G short in women, P short is in penis of the patients. And the last thing is, like you bum thumb ke baithiye, this is the Tesla chair which is available, which causes a lot of electromagnetic radiations, which causes better stimulation in the women with all the same line of mechanism of action which I have been mentioning till now. I'm really happy that I have come up with a book with Dr. Sejal Ajmera, V for Vagina, and it is available on the website. So any of you who wants this book can just go ahead. And thank you. Volume बढ़ा. So thank you for coming.
Thank you, Dr. Parul. After such a beautiful audio-visual mesmerizing talk.